Copper kills 99.9% of bacteria within 2 hours of contact. Not with chemicals, not with UV light, not with heat. On contact, the metal itself destroys bacterial cell membranes through a process called contact killing. It works against MRSA. It works against E. coli. It works against influenza. It works against the coronavirus that causes COVID-19. The EPA registered copper as the first solid antimicrobial material in 2008. A clinical trial across 3 hospitals found that copper surfaces reduced healthcare-acquired infections by 58%. A square foot of copper costs $4. A single hospital-acquired infection costs between $28,000 and $33,000 to treat. Every hospital in America could retrofit its highest-touch surfaces for less than the cost of treating 10 infected patients. Not a single major hospital system has done it. This video explains why. Let us start with what is happening on the surface you touch the next time you visit a hospital. When you push open a hospital door, your hand lands on a handle made of stainless steel. When you sit on a hospital bed, your skin contacts a rail made of stainless steel. When you press the nurse call button, your finger touches a plastic housing mounted on a stainless steel arm. When a doctor adjusts your IV pole, both of you are touching stainless steel. Stainless steel is the default material for hospital surfaces worldwide. It is chosen because it looks clean, it resists corrosion, it is easy to wipe down, and it has been the medical standard for over a century. What it does not do is kill anything. MRSA, methicillin-resistant Staphylococcus aureus, one of the most feared pathogens in modern medicine, survives on stainless steel for over 72 hours at room temperature. Published research from the University of Southampton tested 3 strains of MRSA on stainless steel grade 304, the standard used in hospitals. Viable organisms for all 3 strains were detected after 72 hours. On pure copper surfaces at the same temperature, all 3 MRSA strains were completely killed. eMRSA-1 was dead in 60 minutes. eMRSA-1/6 was dead in 90 minutes. Standard MRSA was dead in 45 minutes. Let those 2 numbers sit next to each other. 72 hours alive on the surface. Hospitals actually use 45 minutes dead on the surface. They do not. E. coli on stainless steel survives for weeks. On copper, it is destroyed within 60 to 90 minutes. Influenza A on stainless steel survives up to 48 hours. On copper, it is undetectable within hours. And in March 2020, a study published in the New England Journal of Medicine, one of the most prestigious medical journals on Earth, tested the stability of SARS-CoV-2, the virus that causes COVID-19, on multiple surfaces. On plastic, the virus remained viable for up to 72 hours. On stainless steel, up to 48 hours. On copper, the virus was undetectable within 4 hours. The virus that shut down the world, that killed millions, that overwhelmed hospital systems across every continent, survived for 2 full days on the metal that hospitals are built from. It died in 4 hours on a metal that costs $4 per square foot at any hardware store. Now here is how copper does this, because the mechanism is what makes this so difficult for the medical device industry to argue against. When bacteria land on a copper surface, copper ions are released from the metal. These ions are positively charged. Bacterial cell membranes are negatively charged. The ions are drawn to the membrane electrostatically. Once they make contact, the copper ions disrupt the lipid bilayer, the thin fatty wall that holds the bacterial cell together. They punch through it. The membrane loses integrity. The cell contents, DNA, proteins, metabolic enzymes, begin leaking out. Simultaneously, the copper ions that have entered the cell generate reactive oxygen species, hydroxyl radicals, which attack the bacterial DNA directly. The DNA is fragmented. The cell cannot replicate. It cannot repair itself. It collapses and dies. This process is called contact killing. It has been studied extensively in peer-reviewed published research. A 2021 study published in AX Applied Materials and Interfaces used focused ion beam microscopy in high resolution imaging to observe the process in real time at the cellular level. The researchers documented bacterial membranes being physically destroyed on copper surfaces within minutes. This is not a slow poisoning. It is a rapid mechanical and chemical destruction of the organism. And here is the critical distinction. Chemical disinfectants require application. A nurse or cleaning staff member must spray the surface, ensure full coverage, Wait for the required contact time, sometimes 1 to 10 minutes depending on the product, and then wipe. If the surface is touched between cleanings, it is immediately recontaminated and remains contaminated until the next scheduled cleaning cycle. Published studies on hospital cleaning compliance show that high-touch surfaces in patient rooms are properly disinfected only 40 to 50% of the time. That means half the surfaces you touch in a hospital room have not been cleaned since the last patient occupied the bed. Copper does not require application. It does not require a cleaning schedule. It does not require compliance. It kills continuously, every minute of every hour of every day. When a hand touches a copper surface and deposits bacteria, those bacteria begin dying immediately. When the next hand touches the same surface 30 minutes later, the bacteria from the first touch are already dead or dying. The surface cleans itself between every contact, passively, permanently, without a single spray bottle, a single wipe, or a single labor hour. This is not theoretical. It was tested in the most rigorous clinical trial ever conducted on an antimicrobial surface. In 2013, Dr. Cassandra Salgado and colleagues at the Medical University of South Carolina published the results of a landmark study in the journal, Infection Control and Hospital Epidemiology. The study was funded by the United States Department of Defense. It was conducted across 3 hospitals, the Medical University of South Carolina, Memorial Sloan Kettering Cancer Center, and the Ralph H. Johnson VA Medical Center. Intensive care unit rooms were fitted with copper alloy surfaces on 6 frequently touched objects: bed rails, overbed tables, 4 poles, nurse call buttons, chair arms, and monitor bezels. Identical rooms in the same ICU wards were left with standard surfaces as controls. The result was unambiguous. Patients in copper-fitted rooms had a 58% lower rate of healthcare-acquired infections compared to patients in standard rooms. The study enrolled 614 patients. It was randomized. It was controlled. It was published in a peer-reviewed journal. It was funded by the Department of Defense, and its conclusion was clear. Replacing less than 10% of the surface area in a hospital room with copper reduced infections by more than half, not by a marginal percentage, by 58%. Now here is the scale of the problem those infections represent. The CDC estimates that approximately 1.7 million healthcare-acquired infections occur in American hospitals every year. Of those, roughly 99,000 result in death. These are people who entered a hospital for a hip replacement, a cardiac procedure, a routine surgery, or a diagnostic test, and died from a bacteria they picked up on a surface inside the building. Not from their condition. From the building. The direct medical cost of treating these infections ranges from $28.4 billion to $45 billion annually, according to a study published by the CDC and referenced by the National Institutes of Health. An individual central line-associated bloodstream infection costs between $45,000 and $48,000 to treat. A single surgical site infection costs $11,000 to $25,000. A ventilator-associated pneumonia case costs $28,000 to $33,000. Now run the math that no hospital administrator wants on a spreadsheet. A 200-bed hospital with an average ICU has approximately 30 to 50 high-touch surfaces per patient room that could be converted to copper. At $4 per square foot for copper sheeting or copper alloy hardware, the total retrofit cost for an entire ICU would range from $20,000 to $50,000 depending on the number of beds and the scope of replacement. That is the cost of treating a single ventilator-associated pneumonia case. 1 infection, 1 patient, 1 billing event. The Salgado trial demonstrated a 58% reduction in infections for a hospital that experiences 100 healthcare-acquired infections per year at an average treatment cost of $30,000 each. That is a potential savings of $1.74 million per year in direct treatment costs. The copper retrofit pays for itself in the first week and continues generating savings every year for the life of the installation. Copper does not wear out. It does not need replacement. It does not expire. The antimicrobial property is inherent to the atomic structure of the metal. It will still be killing bacteria on these surfaces 100 years from now. The economic case is not ambiguous. It is overwhelming. So why has this not happened? Follow the purchasing chain. Over 95% of American hospitals purchase their medical supplies and equipment through group purchasing organizations, known as GPOs. A GPO negotiates bulk contracts with manufacturers on behalf of its member hospitals. The hospital gets a discounted price, the manufacturer gets guaranteed volume, and the GPO receives an administrative fee from the manufacturer, typically 1 to 3% of the contract value. This system was designed to reduce costs. In practice, it creates a closed supply chain in which hospitals buy from the vendors the GPO has contracts with and rarely deviate. If the GPO does not have a contract with a copper surface manufacturer, the hospital does not buy copper surfaces. If the stainless steel hardware vendor has a long-term GPO contract with volume commitments, switching to a copper alternative would break that contract. The GPO structure does not optimize for patient outcomes. It optimizes for contract compliance and purchasing volume. A $4 copper bed rail from a small manufacturer competes against a $2 stainless steel bed rail from a vendor with a 10-year GPO contract and a sales force embedded in the hospital's supply chain department. The copper rail kills bacteria. The stainless steel rail costs less on the purchase order. The purchase order wins every time. And then there is the deeper financial reality. Healthcare-acquired infections are costly to patients and insurers, but they generate revenue for hospitals. An extended stay due to an infection means additional bed days billed, additional antibiotic courses prescribed, additional diagnostic tests ordered, additional procedures performed. The hospital that treats the infection it gave you is also the hospital that bills for the treatment. The financial incentive to prevent the infection exists primarily on the payer side. The insurance company, the government program, the patient. The financial incentive to treat the infection exists on the provider side, and the provider is the one making the purchasing decision. This is not a conspiracy. It is a misalignment of incentives so deeply embedded in the structure of American healthcare that it persists even when the solution costs $4 and the problem costs $28 billion. Now let us put this into historical context, because the absurdity of the current situation only becomes clear when you realize how long humans have known about this. The Smith Papyrus, written in ancient Egypt between 2600 and 2200 BC, is one of the oldest medical documents in human history. It specifically prescribes copper for sterilizing chest wounds and purifying drinking water. This is a 4,600-year-old medical text recommending the same antimicrobial surface that a 2013 Department of Defense clinical trial validated. The Egyptians did not know what bacteria were. They did not have germ theory, but they observed that wounds treated with copper did not fester, and water stored in copper vessels did not make people sick. The Phoenicians inserted copper shavings into battle wounds to prevent infection. Greek soldiers stored water in copper vessels during military campaigns. Roman engineers used copper piping for water delivery systems. Ayurvedic medical texts from India, dating back over 3,000 years, prescribed tamra jal water stored overnight in a copper vessel. For digestive and immune health, a 2012 study published in the Journal of Health, Population and Nutrition confirmed that water stored in copper vessels for 16 hours reduced the presence of E. coli, Salmonella, and Vibrio cholerae to undetectable levels. Every major civilization in human history independently discovered that copper kills what makes you sick. 46 centuries of continuous evidence, and the hospital you will visit next week is built from the metal that does not. During the COVID-19 pandemic, the science was laid bare in the most public way imaginable. The New England Journal of Medicine study was published in March 2020 and was covered by every major news outlet on Earth. The Smithsonian Institution published an article titled "Copper's Virus-Killing Powers Were Known Even to the Ancients." Forbes, NPR, Reuters, the BBC all reported the finding. The virus that was shutting down the world died 4 times faster on copper than on stainless steel. The information was everywhere. And in the years that followed, as hospitals received billions in emergency funding for infection control upgrades, as ventilation systems were overhauled, as UV disinfection robots were purchased, as plastic barriers were installed and removed, the bed rails stayed stainless steel, the door handles stayed stainless steel, the 4 poles stayed stainless steel, the nurse call buttons stayed plastic mounted on stainless steel. The one material with 4,600 years of evidence and the EPA's own registration as an antimicrobial surface was passed over in favor of technologies that cost more, require maintenance, and do not work continuously. For anyone watching this who wants to apply the science in their own life, copper is available at every hardware store in America. Copper tape, sold for garden slug control, costs $3 to $5 per roll and can be applied to door handles, light switches, faucet handles, refrigerator handles, and any other high-touch surface in your home. Solid copper hardware, including door handles, cabinet pulls, and switch plates, is available online for $8 to $25 per piece. Copper sheet metal can be cut and fitted to any flat surface. The antimicrobial effect begins immediately upon installation. There is no activation, no treatment, no chemical application. The copper itself is the active agent. It will kill bacteria on its surface for as long as the copper exists, and copper exists, functionally, forever. The Statue of Liberty is made of copper. It has been standing in New York Harbor since 1886. The copper is still there, still intact, still antimicrobial, for $30 to $50 in copper tape and hardware. You can convert every high-touch surface in your home to a self-disinfecting surface that kills MRSA, coli, influenza, and coronaviruses within hours of contact. No chemicals required. No electricity required. No maintenance required. Once, the American healthcare system spends $28.40 billion per year treating infections that occur inside its own facilities. The solution costs $4 per square foot. It was discovered 4,600 years ago. It was registered by the EPA in 2008. It was proven in a Department of Defense clinical trial in 2013. It was validated against the deadliest pandemic virus in a century in 2020. And the surface your hand will touch the next time you walk into a hospital will still be stainless steel. Not because copper does not work, because copper works too well, costs too little, and lasts too long for the systems that profit from infection to allow it through the door. The science is published. The history is 46 centuries deep. The material is at your nearest hardware store. The only question left is the one this video started with. Why isn't it in every hospital? Now you know.